This day, I think, is devoted to the most critical need we have in advancing public health in America, and that is advocacy, to take the best scientific information and make sure it's applied to the right policies in our country.
But what do we do well as a school of public health? We generate evidence, we do research, right? We create the science and the facts that form the lever, the data with which we can move mountains. But if that data sits on the shelf, if that work gets published and collects dust, then we haven't done our entire job.
Together, we hope your ideas, wise counsel, suggestions, and critique will collectively advance the practice of public health advocacy and, as we at the Bloomberg School love to say, protect health and save lives millions at a time.
And I hope you will give serious discussions as to how we can take the credibility of what you do and make it more effective in our political system. We desperately need that. The research must be translated into informed public policy and requires advocacy.
I think what the Gates Foundation and the Johns Hopkins Public School of Health are doing today in having a day-long conference on how to improve advocacy for public health is absolutely the right step to take. There is extensive social science evidence on health and health disparities. However, there is not enough advocacy that ties the research to policy, law, and most important, real changes in people's lives.
We know that advocacy already is a part of the public health armament, and doing it, or seeking at least to do it in a more systematic way, makes wonderful sense for this institution.
So public health at its core is about social change. A lot of the great advances that we've had in our society due to health have resulted from a combination of the development of science on a particular issue and then the advocacy to in fact create change. So one of the places that we've fallen off in public health is we really haven't paid as much attention to advocacy currently as we did way back in the origins of public health.
We're late as a global community in terms of really scaling up a response there, so you need to fire up the advocacy to generate sort of resources and people and personnel, coordination, and logistics, and that is, again, where advocacy comes in because it helps generate that.
We have the capacity. We're the wealthiest nation in the world. We have a political system that allows us to do so much. We have the leadership, we have the innovation, we have the institutions, we have the capacity to do a lot more than we're currently doing.
Institute here at Johns Hopkins on public health advocacy to address not only how to do that, but actually to do it, is those are exactly the right steps to be taken.
An institution like Johns Hopkins could both give credibility to people appreciating that there is a science base, there is something to learn, then transmitting what it is, and then equally as important, training people around the globe to do it in ways that are appropriate for their political system and their culture.
I would just like to encourage Johns Hopkins to keep doing the work and to hopefully give the tools and assets that you have to people broader than just the institution. I think there's a community out there as well that is ready and willing to engage in advocacy that would appreciate a lot of what you can offer.
Our future is going to rest on how well we do advocacy.
I am so excited about this symposium. And as I look through this room, you give me great optimism. You took Dr. King's admonition to heart, where he said each one of us is here for a purpose. Each one of us can make a difference. But you also implied that if you join together and work together, you can really bring about change. And that's what you're doing today. Thank you all very much.